Hello, my beautiful survivors. How are you? This is Karina from Stroke Surviving the Odds. If you are seeing this video, chances are you are on you are on YouTube. Make sure that you hit that bell. That way you know that you are subscribed, you are paying it forward. It's free. And if it's free, it's for me. Also, if you are listening to the audio, it is on Spotify, Apple, iTunes, and all that good stuff. Make sure you like, follow, and subscribe, or even better, share. Share with Sugar Bear. Share and let the people know that there's a community waiting for them. So, Stroke Surviving the Odds is, yes, I say my story, but more importantly, it's the story of you guys and the story of my guests. But you need to know that 28 years ago, I suffered a brainstem dissection that led me to coma interleukin syndrome. I was 25 years old at the time. And I vowed to make a difference to the world. There was nothing for me 28 years ago. And I said, you know what? I'm going to be there with like-minded people and I'm going to help my community. And that is exactly what we are doing. Now, we are recording a little bit later in the afternoon. As a stroke survivor, my energy level, or my concentration rather, is a little difficult to learn things by heart. So allow me to introduce today's guest, Angelia Abouhassan. I hope I said that right. Now, guys, today's guest has had her share of traumas in her life, and she's also a stroke survivor. That makes her even more relatable and more of an important member of our community here. And she also has a very extensive practice in breathwork, in yoga, and she is also a certified trauma-informed coach. So without further ado, I know you guys are going to grab your pen and papers. You're going to take some notes. Angelia's got some information for you guys, and she's got a little something. I'm going to be giving you her link after, so you guys can get in touch with her. Without further ado, Madame Angelia, and I'll let you do you.
Hi, Karina. Thank you so much for asking me to be here. As she said in the intro, I am let's talk about all this. I am a trauma and stroke survivor. As amongst a array of other labels that I carry. But for this purpose, that's probably the most important one. I am also a trauma informed breathwork facilitator and a yoga teacher. These modalities are part of what I've used to find a path forward after experiencing the life devastating stroke that I had. I had a basal ganglia stroke, which means it impacted the deep center of my brain. And left me without vision on my right side. I'm right side affected, and it left me paralyzed on my right side. And I stayed that
Wow.
way for a while because I had a
So
lot of.
yeah, it's breaking, but yes.
Oh, is it breaking up?
It was breaking on my end. I missed what you were
Okay.
saying.
Oh, okay. I it left me paralyzed for about the first 2 years, off and on. I was in and out of a wheelchair, trying to acquire the ability to find some type of mobility. I often tell people I think I slept for the first 2 years after this. I mean, I slept so much. And in the beginning of all of that, I carried a lot of shame and a lot of just negative feedback loops inside of my brain about what had happened and why I was sleeping so much. And I couldn't really pull it together to be a
Can you
participant.
give us examples? There's a lot of things that I want to ask you, and I think right now, um, we're just gonna get into it now, and at the end, we're gonna tie everything together. I need to know, Angelia, what kind of things were going through your mind? Because I know
Oh,
a lot of the audience is also going through that.
sure. I just thought a lot about how I was gonna. I got stuck in the problem. I thought a lot about how this was gonna fix itself, and I wasn't familiar with stroke at all when all of this occurred. And my situation was kind of unique. I was diagnosed with something called RCVS syndrome. It's reversible cerebral vascular syndrome. Initially, I have
Okay.
just recently found out further details about all of this because eventually I just kind of quit going to these neurologists because they weren't really helping. I was getting sicker just taking
So
all the
you had
meds.
you had signs before the stroke.
I had a lot of stress and I had a lot of trauma loops that I was stuck in that I couldn't really figure out how to get out of. And so I guess looking backwards, yes, I had signs. I was
Okay.
deeply triggered. And I was in trauma therapy at the moment that the stroke occurred, revisiting some like history trauma, and that wouldn't kind of get out of my brain or my body. And I wasn't finding
Okay.
solutions with psychiatrists, psychologists, counselors, therapists. I just found myself repetitively stuck in these patterns. you know, to be quite frank, when the Me Too
I
movement
get it.
occurred,
I get it, Angelia.
yeah, when the Me Too movement occurred, it threw me into such a deep pattern that I had never been that deeply stuck in a pattern. And I was so depressed, and I had gone to therapy, was in a
Hmm.
trauma therapy locally, and I was there for about 4 months when the symptoms started, and they started with something called thunderclap headaches. It literally felt like somebody had thrown an axe in the back of my head. It was so
Oh my
intense.
God.
And these headaches
Do
continued.
you still suffer from those headaches?
No, not at all. I had never suffered from headaches prior to this either, but the headaches continued for
Wow.
about 30 days. And the physicians I was going to headache specialists. I was getting emergency appointments. I was continuously going to the ER because I was starting to have neurological breakdown. I was losing the ability to walk.
I can imagine.
My
Yeah.
sight was starting to be affected dramatically, and nobody could really give me answers until I had the full blown stroke. And then I was in the hospital,
Too late.
and
Yeah. It was.
com- yeah, it was past the point of let's fix this quickly before it turns into a stroke. They weren't really understanding what was going on, and they just kept telling me, okay, this is your trauma. This is your trauma. Yeah,
When
that's
was your stroke? Remind me, Angelia.
February. I think it was February 27th of 2019. So it's been a little over 7 years now.
Okay. Wow.
And I came home. I was in the hospital until April. And then I came home still in a wheelchair, still very unable to maneuver myself. Um, and like I just slept. I slept so much. And, the sleeping,
Wow.
I just was devastated because I had young children, and my daughter was still in high school. My oldest was out of the house, but my daughter was still in high school, and my youngest was 8 at the time. And I came home and here I was in this house. My husband had to work and I was in a home that I couldn't function in. My house was a
Oh
split
Lord.
level. So everything in the home was upstairs. The laundry and the family room were downstairs. So I just stayed upstairs for a long time because I couldn't maneuver the steps without my husband strapping himself to
Wow.
me, you know,
So it
and
affected. So it really. Now
is
I
it for
can't hear you.
is it freezing?
It's
Can you hear me?
freezing. Yes, it's freezing. But it's
Hmm.
okay. So now you're going through all that trauma. Let me just go back. So you have all this trauma before the stroke.
Hmm.
You're dealing with it, and your brain is going on and on and on all the time regularly. You
Hmm.
end up having a lot of stress, having the stroke, and then sleeping for 2 years almost after the stroke, totally just unenergetic. How did you decide to come back to say enough?
Well, I don't necessarily know there was a point that I was like, enough is enough. I think it just, I think a divine intervention was involved for sure. And I look at like how everything worked out. I maintained in that trauma therapy. After I had gotten home, I went back and I was seeing a one on one therapist for a while. Just, not really getting very far, but the place that I went to, they do like 6 month intervals and then they pause, and
Okay.
then you go back for 6 months. Well, the woman I was seeing, she thought it would be a good idea to invite me into a trauma yoga class. It was a group
Okay.
therapy setup. So I go into this trauma yoga class. It was all on Zoom because this was all during COVID. And my husband had to log me in. I couldn't figure out how to use my phone or anything anymore.
Okay.
So he's logging me in and all I can do is sit there and breathe. That's all I could do because I couldn't move. I couldn't move my body. My whole right side was so heavy. My
And you
body
were in
would
your
sit like
wheelchair, right?
this. Yeah.
You
My
were in your
body
wheelchair.
I would sit in my bed and I would do this. So, and if I went anywhere, of course, I'd be in the wheelchair because I couldn't really walk very far at all. Like I could get a couple steps in. I had such bad spasticity and tone that my toes curled up underneath my foot pad and they were like stuck up underneath my foot pad. So that's what was preventing me from walking for such a long period of time because I had to have a bunch of surgeries to get the toes straight again. So um, I go into this trauma yoga class and I just sit there and I try breathing. I'm just breathing. That's all I'm doing because I can't really move my body. I'm just breathing. And
Okay.
it stunned me, but it was about 2, maybe 3 months into this. My vision's improving. And
Really?
I am like, okay, what's going on? I didn't even tell anybody for like about a month because I wasn't fully convinced that's what was happening. But then after about a month, I was like, oh my gosh, my vision is completely restored.
Really?
And I,
Wow. W-
at that point, I dove into every single book I could read about breath. And I started practicing. I just started practicing and practicing. And I noticed that the fatigue was decreasing, my brain fog was
Hmm.
decreasing. And I started practicing yoga. My girlfriend said, Ange, I think you should go try some yoga. I said, okay, let's do this. So I started an online class sitting in my bed,
Okay.
doing it from my bed, doing what I could. It wasn't an adaptable class. I just did what I
Okay.
could from my bed. And then I got to the point where I could move to a chair. And then I got to the point where, and alongside this, I kept practicing the breath work that I was learning. And I started seeing things
Hmm.
getting better and better. At that point, I decided I was going to enroll in a functional nutrition practitioner program, and I went back to school. And I never completed the program. I never like certified in the program because it wasn't really something that I
Okay.
wanted to do. I just wanted to learn how to use food as medicine for my own journey. I didn't want to
Yeah.
become a
Yes.
practitioner of functional nutrition.
No,
So
I get it. I did
I
that
didn't
too.
finish that. Yeah, I just wanted to learn how to use the food as medicine. So I started working on that. I've met so many women in this program. One of which is Karina Hines. She posts a lot of stuff, which she did in my old the Breath Lady Project group. She does in some of the stroke groups too. She owns a business called Botanical Kitchen, and
Okay.
she started supporting my journey, and we started figuring out how to get me the right program that was going to decrease the inflammation in my body. And by decreasing the inflammation
Okay.
in my body, it allowed my brain to work better. So I started using food like as actual medicine. I was able to start eliminating some of my prescriptions. I continued the yoga and the breath work. I went to school after that and became a
Talk
breath
about,
work.
hold on, Dana, hold on.
Hmm.
Talk about, let me give you a compliment. Talk about someone that really wants to take her own health on, be your own advocate,
Right.
research, do. That was amazing. That in itself is really, really admirable, Angelia. That's
Th-
really, really nice. Wow. And you're succeeding. And now you cut, cut the inflammation, cut the meds
mhm.
with food that you're eating with the nutrients. You
Yep.
keep breathing. But what I want to know, can you show us what technique of breathing do you find the most overall helpful for detoxing?
Well, I don't necessarily know if there's one technique. There's many different tips that I could give that are useful. But learning how to breathe into your body, because a lot of people will breathe using their nose or their mouth. First tip is shut your
Mm,
mouth. Your mouth is not supposed to be used for breathing at all. There's no
okay.
filter. There's no the air when you breathe into your mouth does not reach the lower lung lobes the best way as it does through the nose, and it
Okay.
also eliminates the production of nitric oxide. So when you're breathing through your nose, your body has a natural pharmacy in it, and it actually promotes a higher concentration of nitric oxide to the body to help you balance and stay out of pain, right? So, and then
Nitro cup.
nitric oxide, yes. So, when you
Okay.
breathe through your nose, your body will automatically start to produce nitric oxide. So, another thing is when you breathe through your nose, don't breathe up the nose. There's a hole. Have you ever seen a skull, a human skull, and how there's this hole right here in the face?
Yes.
Okay, that's where you want the breath. You want the breath to go in. You want it to go in to the face and then down. So the direct path is into the face. So if you're just sitting there breathing, just take a breath, like a forceful breath. You can feel it go up your nose, right? So instead of
Yes.
that, put a little
Yes.
intention behind it. And now let's just breathe into the face and notice the difference.
Interesting.
So next, let's take the hand, put one on your chest and one on your belly button. And if you can't do that, just place one on your belly button and breathe into the face. And notice the expansion
Okay.
that occurs in the body. Rather than breathing up the nose, you want to breathe into
Breathing.
the face, into the nose.
Okay.
And there is a complete difference of direction of oxygen intake whenever you just switch those small patterns.
Okay, because usually people that take a in breath, well, we'll all do that at first. We'll fill in the lungs, but in reality, it's
You
not
want,
about filling in the lungs.
no, no. It's about
Understood.
allowing that
Wow.
allowing that oxygen to get into the body. The breath fills the lungs, pushes your diaphragm, and your diaphragm kind of looks like an umbrella. It sits over top or right underneath your lungs, over top of all of your organs, right? So when you breathe in, it fills that diaphragm. That diaphragm contracts up and almost kind of goes you up. Like it's like this, and then it goes like this
Yes.
and pushes
Yes.
down into the organs to allow the organs to have a little massage. Therefore, it promotes your digestion.
I
It
like it.
helps.
Oh,
It
oh, it helps with digestion.
helps with digestion. It helps massage the kidneys. It helps massage because all of it changes the shape within your thoracic cavity. So
And
these,
correct me if I'm wrong, but after stroke, many of us have in our cavity, like you said, everything is shifted.
Mhm. It feels like it is for sure. I know
Yeah. Yeah.
after the stroke, I had a really hard time filling my right lung lobe. It was almost like it
Okay.
wasn't filling to capacity. And I couldn't
Yes.
feel it fill in the back part of my back on the sides. I couldn't feel it at all because of the disconnection, the neuro issues that I was having in the feedback loop, right? So it took
Okay.
quite a long time and a lot of work of mindful breathing. And when I switched up these few techniques, there's other techniques that are just fantastic to get you to deeper states of meditation or deeper states of
Oh,
relaxation, and then there's activating breath styles that will send more energy into the brain. Now, I'll tell you this, with my stroke survivors, I don't practice a whole lot of activation because we're already in a trauma impacted body that can't
yeah.
handle more activation. And so it's
No.
very like there's so many breathwork facilitators out here, and there has to be caution when you're dealing with certain classes of people, certain types of people, groups of people, because
I love what you just said. Yes.
it's very important to delineate who and what the practitioner is doing for you and if they're doing safe techniques with you. That is super important
Would you
because
say that you are a breath? Would you say that your specialty is with stroke survivors? Is that what
I
you're specializing in,
I don't
or in
really
general?
I don't really classify myself as simply a stroke surviving breath facilitator, but I do work with a lot of stroke survivors. But I also work with a lot of trauma impacted human beings, so,
Okay.
and understanding the aspect of trauma and what's going on inside of the nervous system after experiencing trauma. Stroke is trauma. And understanding that part of it really lets me work with the nervous system a little bit more gently, for sure. Hmm.
That leads me to, you took a certification as a trauma informed coach. What does that entitle?
It's a trauma practitioner certification that I took, and that was so I could understand the impact of trauma and what's happening within the body, within the neurotransmitters, within the hormones, within the body's layered systems. Whenever people are impacted with trauma, and there's so much to talk about around that. And I think it's a really important part of understanding how to work with people, whether it be after stroke, after car accident, after any other type of trauma, and honestly, in
Yeah.
today's society, I really like have a hard time finding people who aren't impacted by that and have altered breath patterns. Your breath pattern is much like your fingerprint. Every single breath pattern is as unique as the fingerprint that we all hold. They're unique to our bodies, unique to our patterns, unique to our
Interesting.
our experiences, our lived experiences. And there's, a lot of, especially women, but a lot of people that have been, forced into these roles of not being emotional, not being or being afraid to cry, being afraid to share, not allowing vulnerability to come in, not allowing, the
Yes.
vulnerability to open up their authentic selves. So, I kind of work with all of that whenever we are working with the breath. The breath is
Yeah.
the best way to lose weight, which was something I found so unique when I was learning all of this, that you don't just, your breath is your detoxifier for sure, but that's how you
Makes
lose
sense.
weight. You lose weight through your respiratory system. And I was like, are you
Makes
kidding
perfect.
me? Yeah, I thought that was the coolest thing to learn. For sure.
Oh my
So,
gosh.
and I know, like, not that I did any of the things I did to lose weight, although I had weight to lose for sure. That was just kind of like a
You
side
wanted well
bonus.
being.
That's exactly. I wanted mobility. That's why I started all of this and I used my own path as my guinea pig path to learn with, to
I
practice
love
on.
that.
And what I have devised, I have a couple programs that I've devised. One is like a 8-week program. I have a 14-week program. And then or annually, I will hold, breath sessions here and there throughout the month. And then I also work with people privately. So, and I'm always
I
open for conversation or anybody that wants to schedule a private session with me to even see if I would be a good fit for them. Um, but yeah, I teach meditation as well. And I think a lot of people misunderstand that when you have a stroke, you have to work, 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 work to get it all back. And I'm not a firm believer in that at all. I believe your body needs rest. It needs safety.
Yes, you need
It
your body.
it
I'm a big believer in pain body,
hmm.
and you're touching. It's not about being a believer, as I know what it does, right? Having
Right.
had generational trauma, then the stroke, I know what happens. And the more in the mind you're playing that loop, like you say, the more your back hurts, the more your neck hurts. I
Yes.
found that when I started releasing these things through your teachings and whatnot, I did see a difference. I've been for 28 years now. I'm a survivor. I've tried a lot of things. Maybe not with you. I can't wait to work with you, but I can vouch that what you do is a huge bonus to all stroke survivors out there
Right.
that
Well,
needs to deal with everything.
you're working directly with the nervous system with breath and yoga. And the
Yeah.
nervous system is not it's not a part of your body that uses language. You have many different layers. Your body is dimensional and you have many layers within this body. So, and these layers in your body do not require language. So you can't, or thinking, like you can't think your way out of these spots. You think you're going to drive these patterns in deeper within to your electrical body, your nervous system. And then your
Yeah.
body is keeping score. It remembers the sensations, therefore feeds that sensational remembrance back into the nervous system. And then you're repeating patterns that just
You're
don't work.
repeating.
Right. And to alter those patterns, what I love about the breath is the communicator of safety or distress within the nervous system. And the nervous system communicates
I
to the
never
rest of
thought
the
of that.
body.
Yeah.
Yeah. And so being mindful about how you breathe, breathing into the face, into the body, engaging that diaphragm in a repetitive pattern. And, I want to say too that this practice is a practice of consistency.
Mm.
It's not a one and done. There's never
No,
going to be a one and done after stroke or after trauma. It doesn't exist. This practice is
I
something that
agree.
you make space for and that you feed your body what it is asking for. And it's asking for a rewiring, it's asking for safety to do
Exactly.
that. And when your body is in safety, it has more energy and more ability to show up with neuroplasticity. It has more energy and more ability to show up with healing properties. And I just like really look at this like, okay, I have to slow down so my body can do the work it needs to do. Sleep is such an important part of this journey. And in the beginning, like I was
That
telling you, I shamed myself for all the sleep I did. And it took me quite a while.
that's why you are where you are now.
hmm Took me quite a while to get those loops of shame of negativity out of my vocal
I
speech,
can
out of my
imagine.
mental loop. And that was all about consistency and awareness. And that's another thing that the breath does is it builds the ability to have stronger awareness around how you are day to day in your present moments as you are moving through the energy of your life. So,
I
yeah.
feel a lot of gentleness coming from you.
Mm.
I feel there's been a lot of work done. You have done a lot of work, but I feel in your words, in you're very comforting.
Mm.
You're comforting, and I feel like you learned how to be gentle with yourself, and you are teaching people to be gentle with themselves too.
Right,
This is
right.
my vision of you. This
Mhm.
is how I see you. And I want to
Thank you.
thank you immensely. I'm sure that we are going to cross paths and we're going to do uh, an event or something together for sure to make sure that, because you taught me a lot. Breathe into the face. I never thought of that. I'm going to be using this.
Hmm.
Guys, this is what we have. We are at 35 minutes, so this is what we have, our time together. Make sure you like, follow, subscribe, all that good stuff. You share with Sugar Bear, you ring the bell, you leave a comment, but most of all, you love yourself as you are. And in the word of Angelia today, sounds good. We love
Wonderful.
you.